So when we are dealing with some of our younger patients, we still have the ability to transport them to the hospital on the unit that we have here. If we're dealing with an infant, what we'll typically do is we'll ask the parents to provide their car seats that they usually have, and we can attach the car seat onto the cot itself, get it secured in there. However, when we have a little bit larger patients that are toddler age and above that still need to be in a car seat, we have a device that we attach to the cot itself called the Pediatric. And this acts just like a car seat, but it gives us a little bit more access to the patient without having to manipulate around in the car seat, securing them. And then typically what we'd want to do is we'd want parents to be on board with us to help us out, usually by calming the patient, by distracting them in some method, as we're doing right here. They may also help with strapping in the patient if the patient is a little bit uncooperative. And then once we get the patient secured in there, there are things that we can do that we'd like our parents to help out with as far as when we're treating the patient in that. And so for that, I will turn it over to Kathy when she's done.
There we go. So sometimes we have to give patients nebulizer treatments for asthma, for example. And what's great about this is we can use the parents as help, because sometimes the child is a little more comfortable with the parents than ourselves. So this is a little nebulizer that we can use for our pediatric patients. So when this is turned on, we can have the parent go ahead and place it close to the patient's face to try to get some of that medication. So the patient is a little more calm with the parent than one of us. And we also have other devices. We have our iPad that can help distract the patient as well as the parent's cell phone.
So the point is we want parents to understand that just because you have a young patient that needs to be transported to the hospital, you don't need to worry about making sure it's done by yourself. We have the ability to support you regardless of whether the patient is a month old all the way up to a teenager. Now we got two.
We all know that children are super active and they can easily slip and fall, or when they run around the playground, fall down, twist an ankle, or get a little bit of a leg injury or arm injury. They're very prone to being active and having injuries, but that's okay. Best thing we can do as parents is just help calm them down and then assess the situation that we're faced with. So if your child has an injury and it's really bothering, like if they hurt their leg and they just can't stand on it anymore, and it's causing a lot of pain, it's swollen, then it's probably good to seek extra help. You can take them to urgent care and get them checked out there, get some x-rays, or you can call 911 like they did here in this scenario. And our EMTs are always happy to come out and help. Just like you saw, they assess the patient and see how they're doing. And if there's a fracture or any sort of injury of the limb, then they'll end up splinting just like they did here today. So if you ever have any issues at all, any concerns, don't hesitate to call 911. We'll be here to help you.